Urinary incontinence is not just a problem that arises with age, as is often believed. It most often occurs regardless of age. Some people experience it after having a child, surgery, or due to stress and fatigue. It usually starts with small things, when coughing, laughing, running, or during physical activity. Many people quietly keep it to themselves, make light jokes about it, or mention it only in the bathroom. And in this video, I will tell you about what usually goes unnoticed, and the not so obvious but very fundamental causes of urinary incontinence. We will analyze which internal processes and muscles are actually responsible for controlling urination, why the problem occurs even in young and healthy people, and why standard methods often do not deliver results. And most importantly, you will get a few simple but truly effective exercises. No complicated routines, pills, or strange procedures. Everything you need to start your journey toward a solution is already in this video. Unfortunately, 70% of my viewers watch my videos without subscribing. And because of that, YouTube thinks my videos aren't useful. So if you enjoyed this video, subscribe, and I promise to give you even more useful information. So, how does the urinary continence system work? There are three muscles in your pelvis: the pubococcygeus, coccygeus, and iliococcygeus. Many people think that urinary incontinence problems are only related to these muscles, but in reality, the issue of urinary incontinence can go much deeper. One of the causes can be the back, and now I'll tell you about that. The fact is that in the lower back, nerve fibers emerge that innervate the sphincters, that is, the muscles located in the pelvic floor. The point is that all muscles function because they are innervated by nerve endings that originate from the spinal root. And when any problems arise in the lower back, in this area, for example hernias or arthrosis, or inflammatory processes in the area of the vertebrae, between the vertebrae, this can simply lead to inflammatory processes in the nerve roots that innervate the sphincter. If the nerve conducts impulses worse as a result of inflammation or compression, then the sphincter of the bladder will also function worse, and this will lead to urinary incontinence. How can we tell if we have a blockage in the lower back? There is a simple test you can do right now. Let me show you how to do it. Stand with your feet shoulder width apart, and you just need to bend down toward the floor. Ideally, if your lower back is relaxed and everything is loose here, you can easily reach down. Your hands touching the floor, like this. It's easy, but if your lower back is tense, people often can only bend like this, or like this, and not reach the floor. This happens because the muscles get stuck and don't allow the lower back to relax and reach the floor. If you can't reach the floor, and it also hurts, especially when you don't just bend at the hips, then that's definitely a problem. And now I'll show you exercises that will help relax the muscles of the lumbar region, improve microcirculation, and of course enhance nerve conduction. Now I'll show you 4 exercises. I've arranged them in order of effectiveness. The 4th one is among the most effective. So make sure to watch this entire video until the very end and do all of these exercises right along with me. Now for the first exercise, please lie down carefully on a comfortable mat. Take one leg over the other leg stays straight. Take a deep breath and pull yourself towards your leg. Release your hands. Hold for 10 seconds and breathe. Pull your leg towards you. And again, inhale from there, hold, and exhale to the side. This practice helps relax the deep muscles of the lower back, improves diaphragm function, and also enhances microcirculation. We need to improve function of pelvic bones because our bones move, and many people have them blocked. And for this, we will need a towel. Squeeze it between your legs, feet on the floor, and while breathing, lift your legs together strongly, hold for 10 seconds, and relax. This exercise improves muscle tone in the lumbar region, as well as the muscles of the pelvic floor. As a result, the function of the sphincters will improve, and urinary incontinence will decrease. So let's move on. Starting position. One leg is bent, the other is straight. Thanks to the exercise we're about to do, the tension will be relieved. If you have excessive muscle spasm in the lumbar region, the nerve endings become exhausted, which means that the conductivity and innervation of the sphincter also improve, and as a result, urinary incontinence will also decrease. So we lift the leg, hold it for 10 seconds, try to bring the leg back a little so it doesn't go forward, but basically the lumbar muscles are engaged. Hold for 10 seconds, lift it but don't touch the floor. Let the muscle relax. From the top, lift it again, hold for 10 seconds. By the way, if you feel back pain during this exercise, pay attention to it. This could be a very serious problem that may lead to osteoarthritis in the future. Osteoarthritis, as you know, at stage 3 or 4 means a hip replacement. So don't ignore pain in this area and make sure you can get an ultrasound or MRI of the hip joint. Once you have done 10 repetitions with one leg without pulling the table, you lift the other leg and now do the same movements but with the other leg, lifting it up and lowering it down. Lift it up, hold for 10 seconds, then lower it down. As a result of this exercise, reflex relaxation of the lumbar back muscles occurs because you are giving static tension to the muscles. That's the principle. Tension is applied to the tense muscle, and it reflexively enters the relaxation phase. We use this reflex principle in the exercise, and after that do one of the most important exercises which will strengthen the pelvic muscles and as a result help with urinary incontinence. Lie on your back and on inhalation, legs bent at the knees. Lift your pelvis up, squeeze your glutes and pelvis muscles like if you want to hold back the flow of urine. Hold for 10 seconds, lower yourself down, and as soon as your glutes touch the floor, immediately lift yourself up again, literally without resting. If 10 times is too difficult at first, start with 5 and add 1 more each following day. With these exercises, you will significantly reduce the tension in your lumbar muscles, improve their innervation, microcirculation, and of course, decrease tension. Dr. Dlin was with you. Subscribe to my channel so you don't miss new helpful videos for your health.